Good afternoon, everyone, and welcome to the eBookings Lunch and Learn. I would like to begin today by acknowledging the traditional custodians of the land on which we stand. And for me in Brisbane, that is the Turrbal people and the Yagara people. And I would also like to pay my respects to elders past, present, and emerging. My name is Niamh Topin, and I'm the Director of Product Strategy at Genie. And today I'm excited to talk to you all about eBookings. So first off, what I'm going to do is share a little bit of background context on what problems we set out to solve with eBookings and what we have observed through a pilot program that we've been running for the last number of months. And then what I'll do is I'll step you through the eBookings workflow for both Genie and Gentu. And then finally, I'll chat to you about how you can get started with eBookings and when you can expect this to go live in your local Healthscope hospital. So at Genie Solutions, our purpose is to deliver better health outcomes through world-class technology. Our vision for achieving this is really centered around three key objectives. The first one is to improve the experience of patients of specialist practices that are using Genie and Gentu, our core practice management software systems. The second is to connect up what is a very disconnected healthcare ecosystem today, and eBookings was really targeting that objective. And the third is to use data and AI to understand how we can provide clinical decision support and workflow assistance back to practices to improve clinical outcomes. So over the last 18 months, we have been collaborating with Healthscope to make progress on our objective of connecting up the health ecosystem. And our initial focus was between specialist practices and private hospitals. And through this partnership, we have developed a digital procedure booking workflow that is really tightly integrated into Genie and Gentu and is designed to save time when booking theatre or procedures at Healthscope hospitals. And this new workflow is what we're calling eBookings. So when we set out on this journey, there was three problems that we identified as being really important for us to tackle when we developed eBookings. For private hospitals, what they were telling us is that they were finding that when specialist practices were booking procedures within their hospital, key information about the procedure or the patient was often missed or excluded. And there was lots of chasing for this information. And unfortunately, just lots of inefficiencies and last minute cancellation at Healthscope hospitals. For patients, they were saying that there was quite poor communication and really a lack of transparency about what was happening with their hospital stay. So sometimes, their procedure would be booked and it might be 3 months, 6 months later before they would hear from the hospital about their stay. And sometimes procedure bookings were cancelled last minute because there wasn't adequate planning done for requirements for patients, such as the need for ICU beds and things like that. For specialist practices, you were really telling us that managing the theatre lists between yourselves and the hospital was extremely labor intensive. We know that there was lots of creating and changing of bookings. There was multiple draft lists being sent each day, and both theatre lists and consent forms were going missing on a very regular basis. So eBooking set out to tackle all of these problems, and I'm delighted to say that through the pilot program that has been running at the Gold Coast Private Hospital, we really have seen a massive improvement in each of these. During that time, we have had practices using both Genie and Gentu, and over 1,000 bookings have been sent. And some of the key benefits that the practices have seen is a significantly improved practice efficiency due to the reduced admin time that it's taking for managing bookings. We've actually removed the need for all draft theatre lists, which is fantastic. Lost forms, so consent forms, are avoided with the booking because the consent can be supplied on the day that the patient is consulted with at the practice and the booking is made. And the booking statuses can be captured in real time. So you know that the hospital has actually received that booking. And if any action is needing to be taken for that booking, you can take that action ahead of time rather than, right on the day of the booking. Patient experiences are also greatly improved, which is great to see, because the booking now goes to the hospital on the day of the consult or when the booking is made. The patient is actually receiving communication pretty immediately about their hospital stay, so that they know the hospital has received that booking. This means that they're not left wondering, what's happening with their procedure. And also we're seeing hospitals can then more proactively do things like health fund eligibility checking. And if there is a question around their eligibility for their fund to cover their procedure, those conversations can be had earlier with patients. And that means less last minute cancellations for patients as well. Than what we were seeing happening before, when hospitals were only aware of, a couple of days or a week prior that a procedure was actually occurring. Here we have some feedback direct from the people that have been using it as part of our pilot. And just across the board, we're seeing is that everyone is just saying how easy and seamless it has integrated into their workflow, and just how much time it is saving them. One practice nurse mentioned that she's going to have to look for additional work to do, because it's actually cut hours off of her work every week. And just across the board, there is less phone calls, less chasing for draft lists, less chasing of additional information from practitioners. And so it's just, everyone can be more organized and more prepared for the bookings that are going to be occurring. Okay, so with that context, I'm going to jump in now and talk you through what the workflows are. We really are taking the happy path here and just wanting to show you a broad idea of what the workflow is going to be across Genie and Gentu. I'm going to start with Genie, but then I'll come back and I'll step through Gentu as well, for those of you that might be Gentu users. So it all starts with, I guess, making sure that when you're setting up the patients or you're consulting with the patients, that you're capturing the right information. So for each patient that you want to create an e-booking for, there is now a minimum set of information that is required to be captured in the demographic window within Genie. This is mostly information that you guys would have been capturing already, but again, we are open to feedback if any of this information is causing concern. But it includes things like name, date of birth, gender, phone number, the address information, Medicare card and private health insurance, and also Medicare expiry. Now, we know that many of you don't always capture Medicare expiry. So for Medicare expiry, the ask is that it's either valid or it isn't there. So you can remove it if you don't have it. If at this stage the doctor has also consulted with the patient and the consent form for the procedure that you're doing the booking for is available, what we ask is that you scan the form and you attach this into the patient's record, which you can see just down here on the bottom right-hand corner. Because when you're creating the e-booking, there's actually an opportunity to either attach or upload the consent form from within the patient's record or from your local computer as part of the e-booking process. So once the patient and the consent form has been dealt with, the next step would be creating the procedure itself. Now, this can either be done from the clinical record or from the appointment book. So, you guys continue to follow the normal process that you have within your practice for actually starting and creating these procedures. Again, when creating the procedure, there is a minimum set of information that we do require to be captured. This includes things like the procedure name. At the moment, we do ask that you include left and right in the actual procedure name, because the tick boxes underneath aren't transmitted, but they will be transmitted in a more updated version of Genie shortly. You then also need to capture things like who's the provider doing the procedure, what's the procedure date and admission time, much of which will populate from the appointment book. There is a new field in Genie for inpatient nights. So this is capturing, it'll be 0, obviously, if it's a day surgery, and 1 if there are multiple nights, if they're staying in hospital. The procedure type, which again is day surgery or inpatient, and then the assistant, anesthetist, and anesthetic type, if that's known. In the quote tab, Financial information such as the private fund and the fee schedule do need to align. So as an example, if you have a private fund selected as Australian Unity, then the fee schedule should be private or the fund's fee schedule. But if the patient is uninsured, then the fee schedule should be uninsured. And we will prompt you as part of the eBookings workflow if those things don't match, because the hospital does require that kind of financial consent information to understand how you plan to bill the patient. The other thing is that we do require at least one item number to be added to the quote in the procedure. Now, for cosmetic practices, these can be custom item numbers. If you're a different specialty, then this would be the MBS item number for the procedure that you are going to be performed, or that is planned to be performed. When you're ready to create the e-booking, you simply click on the e-bookings button. That's highlighted with a blue box here down the bottom of the slide in the procedure window. So if you're missing any key pieces of information at this point, either within the patient record or within the procedure, initially you'll actually get a validation box indicating, please enter the patient's date of birth as an example. Otherwise, if you have entered in all of the required information, the e-booking modal will open up straight away, and that just opens up on top of your Genie procedure workflow. In this window, the first time you open it up, you will need to select the provider number for the practitioner for the hospital that they're operating at. If you're doing e-bookings for only one hospital, then you can actually set a default here, so you won't have to select this each time. But please do make sure that you select the correct provider number. And then, as you'll see down the bottom, there will be the option to upload the consent form. So here you can choose to upload either from the patient's clinical record, as I mentioned before, or attach a copy of the consent form that might be saved on your local computer or on your network. For those practices that don't actually capture the consent form at the time of booking, and we certainly had quite a number of gastroenterology practices that consent on the day, there is an option to present on the day, the consent form on the day of the procedure instead. So you would just choose that second button for present on the day and then hit create. Once all the procedures have been booked, so that's the end-to-end workflow. You can, of course, update procedures. You'll be able to cancel procedures. I'm not going to cover all of that today because we will be providing more information out to you guys in the form of a welcome pack from HealthScope, and also our knowledge base articles where it does go into the workflows there. We just wanted to give you a rough idea of the end-to-end workflow for just creating. So, but once they are all created, you can view all of the procedures that you have created and the status of those procedures in what we call the eBookings theatre list. Now, in Genie, this is accessed through the appointments menu in the appointment book and by selecting the eBookings theatre list. As you can see at the top of this screenshot, you can select the date of the procedure, filter by the provider that you're looking to do the theatre list for, and then it will present a summary of all of the procedures that are occurring on that day for that provider. If a booking is identified as a needs action or cancelled, which is just what we're highlighting here down in the bottom right-hand corner, you will also receive a reason for why that is the case. Some of the common things that we have seen for needs action is maybe the phone number is incorrect, or we did have some when the Medicare expiry, we were allowing the Medicare expiry to go through invalid previously. And so, if you are seeing those and you think they're problematic, again, give us feedback and we might be able to resolve them. Otherwise, it's really just giving you an indication of what steps you need to take to be able to finalize and get that booking accepted. Now, eBookings currently takes away the need for sending any draft lists. So when you're doing procedure bookings, you just do the booking as part of creating that procedure, and there's no need to send any draft lists across to the hospital. But there is still a need to send a final list. And so that can be done using your usual communication method. So if you're using HealthLink or Medical Objects or email or fax, that's fine. So in Genie, you just generate your theatre list as normal. But what we do ask is that you very intentionally select the mark as final option when generating this theatre list, so that the hospital bookings team know that you're intending this to be the final list for this surgery. And then you send that across to the bookings team so that they can finalize the order and the timings of the list. And they're just asking there that this is sent through at least the day prior to the actual theater session. And that's the Genie workflow end to end. So taking a look at the Gentu workflow, it is a very similar workflow. Within the patient details area, it's the same minimum patient information that is required to be entered into the patient record. So name, date of birth, gender, phone number, address, Medicare details, and private health insurance. Similarly, if the consent form is available for the patient, so the doctor has consulted and the consent form is available, we do ask that you go into the patient's either their appointment or their clinical record, click on the add function there and choose the new attachment option, and the consent form is actually added in to the patient's record. The next step is then creating the procedure, and again, no change to the practice process for creating these procedures. So you just use the normal process that exists within your practice. Very similar set of information required. Here, you'll notice in Gentu, we don't have inpatient days and nights. We only have inpatient nights, but otherwise, entering in your procedure description or the procedure name, the procedure type, who the provider, the date, the admission date, and the assistant anesthetist and anesthetic type, if known, is great. Gentu is different in that you're not actually required to have a full quote completed for within Gentu to do an e-booking. Instead, over on the right-hand side, we do have the billing items that are associated with this procedure booking. And so the ask there is that one item number is added to the billing items. Again, if you're a cosmetics practice or a practice that doesn't use MBS item numbers, then you can just add a custom item number, and then depending on your specialty, otherwise it would be the MBS item number or numbers for the procedure that is going to be performed. Once the procedure is created, in Gentu, what you'll see is that there's an e-bookings button at the top of the procedure record instead of at the bottom of the procedure record. Same process though, if you're missing any information in the procedure or in the patient record, you'll get some prompts or validations to say what information is missing. If you're not, then this e-bookings modal will open up. It actually slides out from the side in a drawer rather than as a screen that hovers over the top of the procedure. And in there, you'll select the provider number. Again, you can set the default the first time that you do this. Choose your consent form if you have that available from the clinical file or your local computer, or again, choosing the option to present on the day, and then just clicking create to finalize the creation of that e-booking. For Gentu, when you want to see the summary of all the bookings that you've done and the status of those bookings, you come back into the appointment book. And then over on the top right-hand corner of the appointment book, there is a menu option. In there currently is things like pending birth or the appointment schedule. And there's a new option in there now called eBookings theatre list. So you click on that eBookings theatre list, and it's the same screen that opens up in Genie. So you can filter by the date, filter by the doctor, and you can see all a summary of the bookings that have been booked. Here you can see one of the needs actions actually, and as you can see, you can make this window bigger so you can read the full reason. But as you can see, some feedback will be given about why a procedure has been cancelled or what action needs to be taken. From a final theatre list point of view, Gentu is a little bit different. We don't actually have the mark as final concept in Gentu as yet. So you do still need to send through your final theatre list for Gentoo practices. So you click on your print function, choose your theatre list and generate your theatre list. But then what we're asking is that when actually naming the document type, can you just put final in the name of the document before it's emailed or sent off to the hospital? And that way, again, is just a way for the hospital to know that this is intended to be the final version of the theatre list, and they can go ahead and finalize anything to do with the orders, admission, fasting times, and so on for those patients that are on the theatre list. So look, that's it. That's the workflow end to end. So as you can see, really tightly integrated into the existing workflows, and really just a couple of additional clicks to send this off at the time of booking the procedure. As I mentioned, you can cancel, you can update bookings as you need. I'm not going to cover that today, but we will be sending out links to our knowledge base, and Healthscope will be sending you out a welcome pack. So please do take time to, dig in and read that information and familiarize yourself with those workflows. So then I guess many of you might be wondering, how do you get started and how can you start using it? So if your practice has registered for this webinar, then you've actually already registered your interest to use eBookings. So that step is done. If for some reason, you've gotten access to the recording or you've joined this webinar through a link that somebody else has provided you, then you will need to go and register your practice to use eBookings. This form is, the link for this form is available in an email we sent out towards the end of last week, or it's also available on our knowledge base. So you click on that link and just complete your registration to use eBookings. For Genie customers, if you're on an older version of version 10, you will need to upgrade to the latest version of Genie V10, because eBookings is only available in that latest version of V10. For those customers that are on V9, the same thing, you'll need to update to version 10, and just making sure that you get across get onto the newest version of version 10. Shortly after the webinar, or shortly after you have registered, Healthscope will send out the welcome pack. So please take some time to review that. It's providing a bit more detailed information than what we're covering here in the Lunch and Learn today, and really just giving you some tips on, getting set up and the best practice workflow for your practice with your hospital. And then finally, on the day that eBookings goes live at your local hospital, we will be sending out an email to Genie customers and Gentu customers to let you know that eBookings is available. If you're a Gentu customer, we'll also have an in-product announcement, so you'll be able to see that within the product itself, that eBookings is available. And then once it's live, you can follow, and you're on the right version for Genie, you can just follow the instructions on how to get started and start sending eBookings across to the local hospital. So from a timings perspective, next Monday, or the week commencing the 25th, we'll actually be going live at the Gold Coast Private Hospital. As I mentioned, we have been running a pilot there for a while, and but it'll be a wider rollout to all practices that want to participate at the Gold Coast Hospital. In October, the week commencing the 16th of October, we'll be going live at Brisbane Private, Peninsula, Tweed, Day Surgery, and Sunnybank. The 23rd, the week of the 23rd, it's Darwin, Mount, Ashford, Flinders, and the Memorial Hospital. And then the last week of October, it's the National Capital, Campbelltown, Hunter Valley, and Nepean. Once we get into November, we're heading into New South Wales, and it's Newcastle, Northern Beaches, Northwest, Prince of Wales, and Sydney Southwest, the week of the 6th of November. And the week of the 13th of November, Hobart, North Park, and Ringwood. And then the final stage that we have planned at this stage is the 20th of November. And that will see, the week of the 20th of November, we'll see Holmesglen, Melbourne, Knox, and John Faulkner Private Hospital going live that week. So there will be more communications coming out from your local hospital, and you'll see it in your newsletter and communications that come from the hospital as well over the coming weeks.